If you have 5 minutes now, then I'll show you how to deal PCOS a fatal blow with the ketogenic diet, even if you've tried everything else before. Hi, Vivian here from my Uber Keto Diet. Quickly, what is the ketogenic diet in a nutshell? The ketogenic diet is very low in carbohydrates, moderate in protein, and high in fat. Through the restrictions of carbohydrates, your body is forced into a state called nutritional ketosis. Your fat cells begin to release fatty acids, which your liver will then break down to produce what are called ketones. Those ketones are produced when the body burns body fat for energy or fuel. On keto, your insulin, the fat-storing hormone, levels drop greatly, which turns your body into a fat-burning machine. Thus, the ketogenic diet enables your body to access stored fat as a primary form of energy. Now your body can burn unwanted stored fat in the absence of elevated insulin levels, which leads to weight loss and revitalizes your health. Now, Dr. Jason Fung said, people are spending millions of dollars on infertility treatments when really we could be changing their diets and having an impact. Can it seriously be so easy? Well, let's find out more. What is PCOS? Polycystic ovary syndrome, PCOS, is a very common endocrine disorder in women of reproductive age. Basically, it affects a woman's hormone levels. Now, polycystic means many cysts. Now, this hormone imbalance causes women to skip menstrual periods and makes it harder for them to get pregnant. Women who have PCOS experience chronic, painful symptoms and fertility problems that can be very difficult both physically and emotionally. The most common symptoms of PCOS are irregular periods, including amenorrhea, the absence of menstruation, infertility, weight gain, trouble losing weight, acne, hirsutism, that's excessive growth including in places women don't usually grow hair, such as on the face and abdomen, androgenic alopecia, thinning hair, fatigue, mood swings, low sex drive, and acanthosis nigricans. I hope I said that correctly. And this is a skin condition characterized by areas of dark, velvety discoloration in body folds and creases. But just remember, not all of these symptoms appear in all women. Now, women with PCOS have increased risk of cardiovascular disease, non-alcoholic fatty liver disease, sleep apnea, depression, anxiety, type 2 diabetes, cancer, and Alzheimer's. Now, 50% of women with PCOS are overweight or obese. Both obese and non-obese women with PCOS are more insulin resistant than healthy women. Women with PCOS have an increased occurrence of obesity. Women with PCOS have higher insulin levels. Insulin resistance affects 65 to 70% of women with PCOS. To classify PCOS, you need to have 2 out of these 3 conditions: hyperandrogenism, oligo or anovulation, polycystic ovaries; hyperandrogenism, excess of male hormones, too much testosterone, main androgen in the body, which is produced by the adrenal glands and the ovaries, however, mainly by the ovary. This causes acne, facial hair and body hair, and androgenic alopecia. The liver produces low sex hormone binding globulin, and this partners with the testosterone to move around the body. However, there is always more testosterone than the low sex hormone globulin in the body. As a result, the testosterone that does not bind with the low sex hormone globulin causes havoc in the body. Now, the question needs to be asked, why is there too much testosterone? High insulin. Studies have shown that the higher the insulin, the higher the testosterone. However, the low sex hormone binding globulin is lower, and this leads to masculine features experienced by women with PCOS. Now, let's have a look at polycystic ovaries. Here we have a normal cycle, and on the left we have a polycystic ovary full of cysts. Now, why are these cysts developing? Women are born with a limited number of primordial follicles, which have the potential to develop into a mature egg. Primordial follicles remain dormant until drafted for growth into a primary follicle. Thus, follicle numbers gradually decrease with age because you only have a set number of these follicles. When the follicles are fully depleted, women undergo menopause and can no longer have children. Only one of these secondary follicles is selected to become the dominant follicle, and the rest simply shrivel away and are reabsorbed by the body. The dominant follicle grows into a pre-ovulatory follicle. During ovulation, because of the rise in LH hormone, the egg is expelled into a respective fallopian tube which carries it into the uterus. The rest of the dominant follicle becomes the corpus luteum, which secretes estrogen and progesterone to support the hope for pregnancy. Now, let's have a look at a PCOS ovary. Now, PCOS ovaries have up to 6 times the normal number of small primary ovaries, and this occurrence is due to high testosterone levels. Too many primordial follicles were forced to become primary follicles as a result of high testosterone levels. It is quite shocking to realize that because a woman has a set number of primordial follicles, premature depletion may cause premature menopause. With PCOS, there are a lot of follicles, but no dominant follicle is selected. What happens is that these small follicles become cysts, and this is called follicular arrest. So no follicle matures to release an egg for fertilization. If we have a look at the image, we can see in A that the surge of LH selects the dominant follicle, which leads to a normal cycle. In section B, the high insulin levels make the follicles very sensitive to L hormone and they stop growing. So the follicles accumulate fluid and become cysts. Too much insulin results in follicular arrest and therefore polycystic ovaries. Oligo and ovulation. The failure of ovulation causes the absent or irregular menstrual cycles. As we can see in the graph, everything is caused by high insulin. High insulin also overlaps with type 2 diabetes and obesity. High insulin or hyperinsulinemia really causes serious health problems. What can you do to deal PCOS a fatal blow? Number 1, a ketogenic diet. Remember, a keto diet lowers your insulin, which in turn will lower your testosterone. The effects of a low carbohydrate ketogenic diet on PCOS. In the conclusion, in this pilot study, a low carb keto diet led to significant improvements in weight, percent free testosterone, LH, FSH ratio, and fasting insulin in women with obesity and PCOS over a 24-week period. A ketogenic diet has been shown to have very positive effects, reducing both insulin and inflammation. And best of all, there aren't any lasting side effects due to prescribed drugs, which are more than balanced out by improvements in weight, blood pressure, blood glucose control, and dyslipidemia. Plus, have a look at this. A ketogenic diet may restore fertility in women with polycystic ovary syndrome. A case series. It really is that simple. Only change your diet. We have a delicious 28-day keto meal plan that will reduce your insulin levels and help you burn fat, but more on that later. So number 2 is berberine. Berberine is a plant extract used in traditional Chinese medicine. It's been making a huge splash both in scientific journals and clinical practice, thanks to its near pharmaceutical effects as an anti-diabetic agent. Berberine is nothing short of a superstar for blood sugar regulation and for PCOS. One of the most common prescription treatments for PCOS is metformin, a drug that improves insulin response. But studies have found that berberine is able to do this too, far better than metformin. It stimulates cells to take up glucose so blood sugar and insulin levels drop, resulting in ovulation for women with PCOS. And a study found women taking berberine lost much more weight than the women on metformin. Now let's have a look at this study. 89 women with PCOS received either berberine, metformin, or a placebo for 3 months. After 3 months of treatment, the women with PCOS who took berberine saw greater reduction in body fat loss than metformin or placebo. Berberine lowered insulin and glucose levels similarly to metformin. In addition, taking berberine lowered total testosterone levels similarly to that of metformin. In this study, berberine in the treatment of type 2 diabetes. In the conclusion, they stated that berberine appeared to be efficacious for treating hypoglycemia and dyslipidemia in type 2 diabetes. But don't worry, I will email you all the info with regards to the berberine. Number 3, sleep. Quality sleep is harder to come by for most women with PCOS. In a review published in Human Reproduction, researchers found that sleep disturbances were twice as common in women with PCOS compared with those without. And women with PCOS especially have difficulty falling asleep. The good news for women with PCOS is that sleep disturbances will most likely be cleared up by the keto lifestyle. Please go to our YouTube channel, My Uber Keto Diet, and look for the video Sleeping Problems. This will help you sleep like a baby. And while you are there, please subscribe to our channel. Number 4, exercise. Trust me, you will want to hear this. Just bear with me. In this study, they concluded high intensity interval training for 10 weeks improved insulin resistance without weight loss in women with PCOS. Body composition improved significantly after both strength training and high-intensity interval training. This pilot study indicates that exercise training can improve the cardiometabolic profile in polycystic ovary syndrome in the absence of weight loss. Remember, they didn't change the subject's diets, all they did was exercise. It gets even better. The exercise groups exercised 3 times weekly for 10 weeks. Did you hear that? Not hours and hours, no, only 3 times a week. Just imagine if you change your diet and exercise a little. Wow, don't you think that's great news? Additionally, exercise also has some direct stress-busting benefits. When you join my Uber Keto diet, you can also join our HIIT exercise program, which will improve your insulin resistance, and it is the ultimate age-defying exercise system out there, so you get best of both worlds. And on top of that, you can do it in the comfort of your own home. Trust me, a ketogenic diet can instantly change your health and weight. The mystery of losing weight and gaining control of your health vanishes, and suddenly you will be feeling healthy, shedding pounds daily, and regaining your lust for life. Losing weight can be fun when results are consistently good. You get results and you feel ecstatic, and the problems keeping you up at night become far and few between. But you gotta find the right and effective ketogenic diet that will bring real life results. Not some program that costs an arm and a leg but leads you down a rocky road of disaster with no tangible results. So here's what's up. You need to know that a one-size-fits-all approach does not work. You are unique. No two people are the same. If you and your, let's say, friend, sister, brother, mother, or aunt follow the exact same diet, well, the results won't be optimal for you because you are unique. Your height, age, gender, activity levels, weight, goals you set for yourself are not the same. Personally, I wouldn't attempt just any ketogenic diet without having a proven step-by-step guide to follow. And this is especially true if you want to save time, money, and frustration. I mean it. That is why we at my Uber Ketogenic Diet created our ratio-based 28-day meal plan customized to your individual needs. And this, my friend, is the cornerstone of a successful ketogenic diet. This 28-day meal plan is all about moving you in the right direction. You will know exactly how many carbs, protein, and fat you should be eating daily. And that is where most people fail dismally on a ketogenic diet because they get their macronutrients ratios completely wrong and sadly throw in the towel. And more often than not, even gain more weight. And listen to this. If one of your input values for your ratio changes, such as your weight or activity level, you simply recalculate your ratio and get a new customized meal plan. So you see, at any given moment, you will fully optimize your weight loss efforts. Right, so I really enjoyed making this video for you. If you know anybody who would find this information helpful, please share it with them so we can revolutionize our health and help one another. I know it sucks to struggle to lose weight and correct health, but pure bliss when you do succeed. Wouldn't you agree? So you now have your unique ratio. All you need to do is pair it with your tailored 28-day meal plan and you are good to go. Click the button below this video and I will see you on the inside.